Hey guys, it's Jacob
Daryl.
and we're going to be talking to you about the biomechanical risk factors that influence foot and ankle injuries. So we've learned a lot about this stuff in Rose's class over the summer, but we're going to do a little review for this workshop. So first off, we're going to start with a video right here. And, we had to pick something sports related because our field is athletic training. And what better way than with somebody breaking their ankles on the basketball court? Just like that.
He wasn't ready. Alright guys, well, some common foot and ankle injuries that we learned about over the summer were ankle sprains, mostly like lateral medial ankle sprains. We have medial tibial stress syndrome, Achilles tendinopathies, chronic ankle instability, Sever's disease, high ankle sprains, plantar fasciitis, and we've also learned about many more.
So some of the general risk factors for any injury are going to be your age, your bone structure, your posture, body weight, whether or not the sport you play is really intensive as far as contact goes. So obviously things like bone structure, if you have genuvarum or valgum or coxivara, coxivalga, anteversion, retroversion, all those things are going to send issues down the chain where your body's going to try to compensate, or maybe it doesn't compensate, and then you can develop some sort of pathology because of that. Age, usually as you get older, your bone density decreases, you can be set up for more fractures and things like that. Posture, whether or not you have like flat feet, toe out, all sorts of crazy different things, those can all set you up for injuries when you're running, when you're walking. And then if you are a heavier individual, you're more likely to sprain your ankles and suffer a lot of lower extremity injuries just because you're much bigger and your center of mass doesn't move as well. And so when you're trying to compensate with ankle strategies and hip strategies and things like that, you have decreased proprioception, and so that can set you up for injuries. All right, so we got another video about injuries. Sorry.
Ankle sprains are among the most common injuries to the lower extremity. These are a result of a fall or misstep during ambulation and sporting-related episodes. This injury is classically observed as an inversion injury at the ankle and subtalar joint of the foot, whereby several structures may be injured. The anterior talofibular ligament rupture is seen with the positive anterior drawer sign in the lateral radiographic view, whereby the talus will protrude from the ankle joint. Likewise, an injury to the calcaneal fibular ligament will result in a positive talar tilt seen between the alignment of the tibial plafond and the talar dome.
Whoops.
As we all learned over the summer, ankle sprains, they're a traumatic damage to the ligamentous support of the ankle, whether it be the deltoid ligaments or lateral ligaments. This can happen medially with an eversion sprain, or it can happen laterally, which is the most common with an inversion mechanism sprain. It can happen in contact or non-contact injuries. You can be playing basketball, step on someone else's foot, step in a pothole, fall off the curb while you're running around downtown in Winchester. Ankle sprains can happen in many different ways, and those are some of them.
So in some of the articles that we looked at when we were trying to find like documented risk factors for all these different injuries, we found some stuff that talked about muscle imbalances. So in a lot of cases with lateral ankle sprains, you have weak everters and you can't properly stabilize your foot, and so you just go straight into eversion and you just pop that ATFL on that calcaneofibular ligament and your ankle swells up like the picture on the right. In some other cases, you have weak dorsiflexors. So again, your plantar flexors take over, and that plantar flexion inversion mechanism, that very common ankle inversion sprain with the ATFL ligament, kind of just takes over. Some other interesting things. In one study, they showed that the tibiofemoral angle did not really predict ankle sprains. So if you have like a varus or valgus deformity at the knee, that doesn't necessarily set you up for ankle sprain injuries. In that study, they found that previous history of ankle sprains, your body mass, how large you were, and how old you were actually more predictive of ankle sprains. And then in another study that we looked at, obesity tends to decrease the amount of proprioception that you have. So it's harder to come back to your normal balance after you've suffered a perturbation. and that itself, because of the decreased ability to use your ankle strategies properly, can lead to ankle sprains.
And now we're going to talk about high ankle sprains. High ankle sprains is a disruption to the interosseous membrane of the tibia and fibula, and or the superior tibiofibular ligament and the tibionavicular ligament. All three of those are shown in the picture on the right. If you all have been working through clinic, you've probably seen a couple high ankle sprains already, and you've noticed that they usually take twice as long as they heal compared to a lateral ankle sprain. The most common cause for high ankle sprains is usually dorsiflexion with external rotation of the foot. This rotational force puts a lot of tension on these ligaments, and which they can't handle.
All right, so we got another video for you guys. This one involves a high ankle sprain. And we're just going to kind of skip ahead here. And watch her left ankle right there.
Injury usually seen in ankle and foot injuries is the medial tibial stress syndrome, also known as commonly known as shin splints. It's a lot of overuse injuries of the tibial and tibial musculars. A lot of runners see this. Anyone who runs a lot, soccer, lacrosse, football, sometimes they even see it. Most of the pain is going to be typically in the posterior tibialis, flexor hallucis longus, and the flexor digitorum longus.
So in the research articles that we looked at, they did a lot of studies with runners, high school athletes, and then adults. And the big things that they noticed that were kind of contributing factors to medial tibial stress syndrome were navicular drop and pronated feet. Those are pretty much the two key risk factors in developing this condition. And if you remember back from Denise's talk on gait, the posterior tib is the muscle that controls eversion during gait eccentrically. And if that thing's overworking because your feet are way too pronated, that can give you all sorts of posterior-medial shin splint pain.
The next injury that we're going to look at is the Achilles tendinopathy. In the picture to the right, you can see a thickened Achilles tendon in the patient, and it's usually caused from inflammation of the Achilles tendon. It can present as acute or a chronic injury, but it's usually caused by extreme overuse or a traumatic incident.
So in some of the studies that we looked at, a lot of different things were found to be contributing factors or potential risk factors for Achilles tendinopathy. The big one in a study on running athletes was high braking force. So during deceleration, you just load up that tendon, and that can cause it to get inflamed, strain it a little bit, do all sorts of bad stuff, and that'll just cause it not to either heal correctly because you keep using it in that fashion, or if it becomes a chronic condition, it kind of scars up and the tissues don't work as well. And then in a study with foot orthoses and how they affected foot kinematics, just the big thing that they noticed was that people who have Achilles tendinopathy tend to have more eversion, dorsiflexion, and knee flexion during stance phase, and that's typically when you're gonna see the most injuries during gait for Achilles tendinopathies.
The next injury we're going to look at is the chronic ankle instability. As you can see on the picture to the right, that ankle is not the way it's supposed to be. This usually occurs after multiple sprains. You usually see it in a basketball player after several years. It involves severe damage to the ankle ligaments, usually the lateral, as shown on the right. This little ligamentous support that the individual has makes their ankles roll even further. They have their weak pronases, which further contributes to their issues. And that's pretty much it.
So in a study that we found on chronic ankle instability, the big risk factors are just a history of ankle sprains, typically your lateral ankle sprains. So if you have an athlete who has a lot of ankle sprains, they may develop chronic ankle instability. Because of that, there's a lot of proprioceptive deficits, and that can also contribute to further injury and just not being able to keep your foot in a stable position. And then biomechanically, a lot of times individuals who have hindfoot varus, So they're pretty much in like a very supinated position, and their calcaneuses are facing inward. They're almost already in that inversion position, and that can set them up for chronic ankle instability. So the next injury we're going to talk about is Seaver's disease, or calcaneal apophysitis, and it's typically an inflammation of the apophysis, or like growth plate area in the calcaneus. You usually see it in childhood, and it can be an overuse injury. It could be a traumatic injury, but it happens a lot in physically active children.
Some of the risk factors for Seaver's disease usually occurs in childhood. Whenever a child usually has their large growth spurt within the 2 years, their 2-year growth spurt, the calcaneus, and what happens is the calcaneus grows faster than the muscles and tendons connecting to it can actually keep up. So your Achilles tendon and your gastrocnemius, soleus, and all those muscles, they can't grow fast enough, so the calcaneus puts a lot of pressure and tension on them. With posture is also a risk factor. So if you have pronated or supinated feet like myself, this can cause tightness in the Achilles tendon due to the malalignment. People with leg length discrepancies, they're shorter legs, so since they have to point their toes toward the ground so they make contact towards the same time as their other foot, this increases the tightness in the Achilles tendon, which therefore creates the tension that's pulling on the epiphysis of the growth plate. Childhood obesity and overweight, and it's the new epidemic, or not new, but an overuse epidemic here in America. With all these, all the weight and pressure they put on the epiphyseal plate, all that tension really can cause Seaver's disease.
So plantar fasciitis is another common foot injury, and it's just going to be, you get that pain all down your foot because you have an issue with your plantar fascia, or the kind of tendinous fascial insertion along the bottom that runs from your calcaneus all the way to your toes and helps tense up and form those arches in your foot when you're moving around. And you can get this from a lot of different things. You could have inflammation from overuse, just loading too much through that joint, and you could also get it through a traumatic injury if you had some sort of weird foot mechanism. And Daryl's going to talk to you about some of the risk factors.
Some of the risk factors for plantar fasciitis are pes planus, which is also known as flat-footed, and pes cavus is the most common posture form that causes plantar fasciitis. Abnormal walking patterns, if you have an abnormal gait, this can cause plantar fasciitis. Plantar fasciitis is really used for shock absorption in the foot, so anytime you disrupt that shock absorption, you might feel pain in plantar fasciitis. A lot of sports players, like long distance runners, dancers, and soccer players that are on their feet a lot and putting a lot of shock in through their foot, they're going to probably have a lot of plantar fasciitis or feel pain in their heel from this. Yet again, obesity is another risk factor for another ankle injury like plantar fasciitis and foot injuries. It increases the pressure placed on the plantar fascia, and just this increase in pressure, oh my fault, this increase in pressure is going to, oh my goodness, here we go. This increase in pressure is going to really irritate and inflame the insertion point on the calcaneus of the plantar fascia. And also jobs that involve standing in a long period of time, like a factory worker or a teacher and stuff. A lot of those workers seem to have plantar fasciitis.
And so here are some of our references that we use for this presentation. We hope you guys learned a good bit and reviewed some of the injuries that we see commonly in clinic. And we look forward to seeing you guys at the AT workshop on Monday.